Creutzfeldt-Jakob disease is a rare, rapidly progressive fatal neurodegenerative disorder characterized by abnormal proteins called prions. These abnormal proteins induce normal prion proteins in the brain to misfold, leading to brain damage and severe neurological decline. Definitions: Creutzfeldt-Jakob disease belongs to a group of diseases known as transmissible spongiform encephalopathies. The disease causes characteristic spongiform degeneration of brain tissues. Types of Creutzfeldt-Jakob disease: 1. Sporadic Creutzfeldt-Jakob disease, the most common form, and it occurs without known cause. It usually affects people between 55 to 75 years of age. Second one, familial or inherited Creutzfeldt-Jakob disease. It caused by mutation in the PRNP gene. It accounts for about 10 to 15% of cases. Third one is iatrogenic Creutzfeldt-Jakob disease. It transmitted through certain medical procedures such as contained surgical instruments or transplanted tissues. It is extremely rare. Fourth category is variants of Creutzfeldt-Jakob disease linked to consumption of products from cattle affected by bovine spongiform encephalopathy, the mad cow disease. The normal cellular prions protein is converted into abnormal forms. Abnormal prions accumulated in the brain. They usually causes neuronal loss, spongiform changes, and gliosis. Unlike bacteria or viruses, prions contain no nucleic acid. Clinical features: early symptoms are memory problems, personality and behavioral changes, anxiety or depression, poor concentration, visual disturbances. Progressive symptoms: rapidly progressive dementia, muscle jerks, myoclonus, ataxia, speech difficulties, visual impairment, muscle rigidity, difficulty swallowing. Late stage: severe dementia, inability to communicate, bedridden state, and coma and death. The diagnosis is based on clinical findings and investigations. MRI brain: characteristic abnormalities in the basal ganglia and cortex. Electroencephalography EEG may show periodic sharp wave complexes. Cerebrospinal fluid analysis: detection of proteins such as 14-T3 protein and RT quick assay. Definitive diagnosis is made by neuropathological examination of the brain tissue. Treatment: there is currently no cure for Creutzfeldt-Jakob disease. Management is supportive and includes control of myoclonus and seizures, pain relief and comfort care, nutritional support, psychological and family support. Prognosis: Creutzfeldt-Jakob disease is almost always fatal. Most patients with sporadic Creutzfeldt-Jakob disease die within 6 to 12 months after symptoms onset. Variants of Creutzfeldt-Jakob disease generally have slightly long course. Prevention: strict sterilization procedure for neurosurgical instruments, careful screening of tissue and organ donors, measure to prevent cattle infection with BSC. Key facts: it is a rare disease, approximately 1 to 2 cases per million people per year worldwide. caused by infectious prion rather than bacteria, virus, or fungi, characterized by rapidly progressive dementia and neurological deterioration. No effective curative treatment currently exists.